Understanding Restorative Care, a training and educational resource for long-term care providers. This is Part 3, Restorative Care Practices. Restorative care is often a journey of small steps. No matter how small, it can still be a step forward. And sometimes the care that an RNA provides can be life-changing.
We've gotten them from where they are bedbound to where they are up, getting out of their bed by themselves and using walkers to go to and from the restroom. And to me, in just a short amount of time, I thought that was, pretty amazing.
It's helping them keep being able to feed themselves, keeping them mobile. It requires a lot of encouragement.
In Part 3 of our series, we're going to provide real-life examples of restorative care practices, including transfer and ambulation, range of motion, splinting, feeding assistance, and assistance with activities of daily living, also called ADLs. But before we cover these topics, we will start with a discussion on motivation and guidance. They are an important part of helping residents move toward their goals. Here are 4 tips. First, break down a task or activity into manageable steps. Do not rush the person. Know when to use cueing and prompting. Second, provide instructions that are easy to follow and understand. Remember to speak clearly and in simple terms. Gestures and facial expressions can also be helpful in communicating. Third, understand what level of assistance the resident requires. This also means having a sense of what the person may be capable of achieving. Fourth, motivate residents with encouragement and praise. It is important that residents feel a sense of accomplishment and are recognized for their effort. This can build confidence. Take, for example, Miss Ann, whom we met in Part 1 of our series. Her RNA helped her to reach her goals with encouragement and a belief that she could do it. She instilled confidence.
She talked to me in a way that was encouraging. And she praised each little step. She had a smile and she could explain mechanically each thing I needed to do and help me with each step.
And whenever she felt like she wanted to take a break, she did, and I still encourage her. You can go a little bit further. You can do it.
The very most of what helped me was the attitude. A very positive, calm, good attitude. And I admire that in people.
Experienced RNAs know that gentle guidance and a positive attitude can help individuals face the challenges before them, one step at a time.
This life is worth living. It's worth trying. You're not gone yet. It's worth it. You have to be compassionate to them, regardless. You're gonna have the days where they just kick you out there room all the time you walk in the door. They don't want you to do anything. Just walk away for maybe an hour or two and come back. Maybe that mood will change. Just don't give up on it. You have to take time, because if you go rushing to them, they feel like you don't want to be bothered with them. So you have to take your time and let them know that you care and you're here to help them in every way that's needed. Give them that hug or that pat on the back that they haven't had in a long time.
Transfer and ambulation. Restorative care can assist individuals in maximizing their ability to ambulate. Residents who are able to do this are more likely to feel a greater sense of independence.
Once somebody gets where they can't get in and out of a chair, they get very frustrated, and just knowing that somebody's having to take you to and from the bathroom and in and out of bed and stuff. So as the, restorative team, that's part of our job, is go in there and help them improve, get them to where, one day they're a transfer from a wheelchair to the toilet. And then, one day, all you got to do, after working with them for months and months, or sometimes just weeks, they can actually get up, and all you do is just kind of help them walk to the bathroom.
They come from home. Some of them can ambulate pretty good. A lot of them can't. And you're able to keep that function going. So they'll feel more independent and able to do things for themselves.
Assessment of the person's strengths and needs determines the level of assistance that he or she may require with ambulation. These levels include maximum assistance, moderate assistance, minimal assistance, contact guard assistance, and standby assistance with supervision. One of the important goals of ambulation is to help maintain or improve the person's strength, endurance, and mobility.
But we can put them on an ambulation program with Restorative so that they continue to walk with them, they get that exercise daily, they maintain that level of function.
This is Mr. Gerald. He became disabled as a result of a car accident. With the help of skilled therapy and restorative care, he has progressed from being bedbound to ambulating with a modified walker.
It's remarkable. It does really well.
Along with splinting and range of motion exercises, his restorative care plan includes ambulation with one person contact guard assist for 15 to 30-minute sessions 5 times a week. With the help of his RNAs, he has also developed the skill of assisting in his own transfer. Mr. Gerald is able to ambulate up to 100 feet. His progress has been life-changing, and much of it began with the encouragement of his RNA.
And I just kind of, assured him that, this life is worth living. I mean, you're still here. So let's make the best of it. And just the look in his eyes that day when I sat and talked to him told me that he was going to do better the next day. And he did.
Meet Miss Bibi, a former school teacher. Her functioning has been impaired by a stroke. One of the goals in her restorative care plan is to help her maintain mobility. Ms. Bibi's restorative care plan includes ambulation with one person contact guard assist, 15 to 30-minute sessions 5 times a week. With the gentle guidance of her RNA, Ms. Bibi is able to transfer from a chair to her walker and ambulate up to 175 feet.
Her mobility has gotten a lot better. She's more, I still have to cue her to kind of stay on point, but she's gotten a lot better.
Here's a final note. Maintaining mobility has allowed Ms. Bibi to function a little more independently in other areas as well.
Going to the bathroom, she's up walking around in her room trying to straighten up a little bit, like she's at home doing her normal routine. And it makes her feel more independent.
Range of motion exercises. Range of motion is the amount of movement that is possible for a joint such as an elbow, wrist, knee, or hip. Individuals with impaired or limited joint mobility will have greater difficulty performing activities of daily living.
So if they're not using the muscle that they have, they lose it. If you're there, keeping them moving, keeping them stretching, it helps. If not, they're going to just stay in that position. They're going to freeze in that position.
The goal of range of motion exercises is to improve or maintain joint mobility. It also helps reduce pain, swelling, and stiffness. Range of motion exercises can also help in the prevention and development of contractures. There are 3 basic types of exercises. Passive range of motion. In this case, the RNA performs the exercise for the resident because he or she is unable. Active range of motion. This means the resident is able to perform the exercises without assistance. And active assist range of motion. With this type, the RNA provides some help to the resident. This is Ms. Sally. She has cardiopulmonary disease and has suffered a stroke. Ms. Sally is bedbound and in a weakened state. Without restorative care, she is at risk for contractures. To address this issue, along with splinting, Ms. Sally's care plan includes passive range of motion exercises on both her upper and lower extremities, 15 to 30-minute sessions, 5 to 7 times a week. The goal for Ms. Sally is to help maintain joint mobility and prevent contractures.
A lot of these people, they begin to contract and stuff, their legs and their arms, just from non-use, they'll slowly start to contract on them. And what you have to do is go in there every day, stretch all the joints out and make sure that you're preventing all that contraction. Because eventually, if you just let them lay there and all you're doing is turning them and cleaning them and all that stuff, eventually they're just going to kind of curl up into a ball. Those muscles tighten. So what you need to do is get in there and actually stretch out everything, depending on the person. 5, maybe 7 days a week. Some we only have on 3, but just to make sure they're not going to get any worse off than they actually are.
Meet Mr. Robert. He is recovering from a stroke. There was a time when he required maximum assistance. Restorative nursing has helped him significantly improve his ability to function. With the guidance of his RNA, he performs active range of motion exercises. It has helped him improve flexibility in his joints as well as his overall mobility. His care plan includes active range of motion exercises on both his upper and lower extremities, 15 to 30-minute sessions, 5 to 7 times a week. Daily ambulation is also an important part of his care plan. He can walk up to 450 feet with minimal assistance.
From bedbound to this, where we're at, it's like a miracle. And I love that because he is so determined.
He walks so good. He is awesome. I am really, really proud of him and good as he's doing. He is very determined. Yeah.
Splinting. These residents are wearing hand splints. They are used to help prevent contractures and hand deformities from developing or becoming worse. This resident's care plan calls for wearing a splint 6 to 8 hours a day. During this time, the RNA also performs skin checks under the splint. This is done every 2 hours. She will look for any signs of redness, irritation, or swelling. She also makes sure that the splint is clean and continues to fit properly and comfortably. For a resident who suffers from contractures, hand splints can provide these benefits: support for weakened muscles, stabilizes joints, helps normalize muscle tone, and can help relieve pain. Another important part of a splinting routine is massaging, stretching, and using range of motion on the person's hand. One of the main goals of these exercises is to try to maintain or improve flexibility. It may also reduce the pain or discomfort associated with stiffness. Feeding assistance. The goal of feeding assistance is to enable individuals to feed themselves as independently and as safely as possible. The goal is also to make sure they receive adequate food and fluid intake.
You want a resident to be able to feed themselves for as long as they can. Restorative is there to provide the ability for them to maintain their ability to feed themselves, but yet give them that input that they need as far as safety doing it. Safety with portion control, making sure they're putting smaller amounts of food on their spoon or fork, and pacing, making sure they're not eating too fast. You don't want to take that away from a resident just because of those things that they're eating too fast or they're putting too much on their fork. They can still feed themselves and they need that cueing. I think we all think that it should be provided. You don't want to take that functional ability away from them when they still have it.
Assessments of the resident determine what type of feeding assistance he or she may need. For example, does the resident require prompting and cueing at mealtime? Does the resident have difficulty swallowing and chewing? Does the resident require modified food such as pureed or thickened liquids? And is there the need for adaptive equipment so the person can perform self-feeding? This is Miss Tina. She is a stroke victim and also suffers from dementia. Her condition affects her ability to swallow. With the help of restorative care, she has progressed from a feeding tube to eating with assistance. To address her swallowing issues, Miss Tina's restorative care plan includes a diet with pureed foods and thickened liquids, and prompting and cueing to assist her in chewing and swallowing. At mealtime, her RNA gently encourages her to complete as much of her meal as possible. Prompting and cueing is used to guide her in the use of her eating utensils. A foam cup is used because it is easier for her to grip.
And you have some that, if you just set their tray in front of them, they won't eat. You have to sit with them, encourage them, help them. And sometimes, some of the patients, you can actually just sit there and help them get a couple bites, and they'll get motivated and they'll feed themselves.
You have to talk nice to them, tell them you love them. You can do it. Put the spoon and do it. Show me you can do it. So, just take encouragement.
It is important to note that a technique as basic as prompting and cueing can have a significant impact on a resident's health and well-being. It can be the difference between adequate or inadequate nutrition.
Well, it's important for restorative to provide those cues and prompts to prevent the resident from having a decline in their functional ability. For instance, if you have someone that can drink thin liquids as long as they do a chin tuck, that's a better quality of life for them because that's more normal than nectar thick or honey thick liquids are. If they are not there to provide those cues, that patient may forget to do that strategy and end up back on a diet that they don't want. Then at that point, they're not going to eat it. You're going to see a weight loss, some malnutrition, and all other sorts of medical issues just because of the fact that no one was there to provide those prompts for them so they can maintain that quality of life that they want.
Activities of daily living. A restorative care program may also include assistance with ADLs. The goal is to promote a resident's independence in areas such as dressing, bathing, toileting, eating, and other types of self-care such as oral care and grooming. This is Miss Francis. She suffers from kidney failure, hypertension, and diabetes. Restorative nursing has helped her improve her overall functioning. For example, she can now walk up to 100 feet with minimal assistance.
From not walking to walking, to being more continent than incontinent. And that's a huge plus for her. And her ADLs, she's able to do some of them.
Miss Francis's restorative care plan includes assistance with ADLs along with a scheduled toileting plan. She generally requires minimal assistance and supervision.
Toileting, she has to have supervision. Walking, she has to have supervision because she's still at risk for falls. She's able to do some ADLs like brush her hair, brush her teeth, put her clothes on, where she couldn't do those things before.
This is Mr. Robert, who you met earlier in our range of motion segment. As we noted, he is recovering from a stroke. He has progressed to the point of being able to perform some of his ADLs with minimal to moderate assistance.
Before he had a stroke, he was independent. When he had a stroke, he was total bedbound. Could not walk, could not feed himself. He is now walking, feeding himself. He's helping with his ADLs. And I want to maintain that and improve it. That's my goal for him. And I'm working on him with his bowel and bladder. It's steps that you have to work with someone.
Restoring hope. Restorative care is also about helping to restore a resident's sense of hope. It's about helping them develop the confidence to move toward their goals. And it's the hope for an improved quality of life.
And we do give them the hope back.
You see them not giving up.
You have to go in here every day with a smile on your face and encourage them, tell them, about stories of, other patients that you've had, that have had the same thing. And you've gotten them to a point where, they're fine.
Meet Mr. Craig, a retired school teacher. He suffered a stroke, resulting in weakness to the right side of his body. Since entering the facility, his overall functioning has improved significantly.
And I either had to get better or lay there. I wasn't about to lay there. But I gradually started to pull myself together and still working on it.
Even though he faces considerable challenges, he lives with hope, and his restorative care team shares that hope with him as they help him move toward the goal of living more independently.
Keep praying and keep going, and you'll get where you want. I feel that way. Don't give up. Do the best you can with what you got.
Experienced RNAs know that gentle guidance, encouragement, and praise can help individuals like Mr. Craig face the challenges before them one step at a time.
Let's do better. Let's go a little bit further today. Because I want you to do better. To be more independent for yourself.
You have to love people in order to be able to do this job.
We do great things here. We put smiles on people's face every day.
It's rewarding to know that you help someone.
I think knowing that you've been a part of a good outcome, knowing that you played a major role.
It just makes your day.
For your post-test, you should be able to name at least 3 levels of assistance that may be given to a resident to help with ambulation. Describe how restorative care practices can help a resident function more independently. Name 3 types of range of motion exercises. Explain the goal of range of motion exercises. Describe the purpose of splinting. And give an example of how to assist a resident with self-feeding.